Doctors of Reddit, what is the most how the duck did that happen to you case you've seen? I once had a patient that got pregnant despite never having sex. She had severe vaginismus and was not able to ever have anything go into her V. But her significant other ejaculated onto her and apparently one little swimmer found an egg. Back when I was a medical student on a urology rotation, we had a guy come in after butterflying his D with a fillet knife. This occurred after consuming a lot of sugar. It was his third time doing it, all three in a fit of sugar-induced psychosis. You'd think he'd steer clear of the old Bolivian marching powder after the first 2 times. Had a lady come to the morgue in pieces for several days. She had fallen off a catwalk thing into an industrial fan that had no guards due to a cleaning being performed on that area in a factory. They were having trouble finding all of her. It wasn't explained to me until 3 days after the first piece showed up, so I thought there was a serial killer out there for a bit. Work in the ED as a medical student. Had a guy the other day who let a leg infection get worse for years, and when he finally came in, his infected leg was at least 4 times the size of the other one and was draining copious amounts of foul smelling pus. If the infection had been seen earlier, he would have just needed antibiotics. Because he waited so long, he's going to lose the leg, if not his life. Working in the ER, we had some interesting ones, but the simplest and most intriguing one I've had was a man came in complaining about chest and side pains. After a few tests to rule out heart issues, we discovered through an x-ray that the man had 19 fractures throughout his rib cage. When I asked him if he had been doing anything dangerous, he replied with nope, just dancing. Needless to say, I'd recommend not trying to do leaping flops into the worm on repeat on concrete, which is the only way I can fathom this occurring. And no, he didn't explain what kind of dancing. Not a doctor but former psychiatric nurse. I have seen all manner of weird and wonderful things, yet the most perplexing was a young girl we nursed in PICU with history of pica. When we took her for x-rays, due to her complaining her stomach was hurting, we found a belt buckle, a full-size spoon and butter knife, as well as an assortment of batteries. As far as I recall, as it was some time ago now, they had to operate immediately to remove, and again if I recall correctly it was the batteries they were most concerned about, as if one exploded, started leaking, it would have caused irreparable damage. I have never seen a set of x-rays like it, and seeing was believing. Incredible how the hell she managed to get them in there, but never underestimate the willpower of psychosis. Was working in under a few years ago. The witching hour was upon us and a man came in looking in some discomfort. He had a delicate issue in his nether regions. He was very embarrassed, so off we went to a cubicle where he told us that he had fashioned himself a not made for purpose cock ring out of a large metal nut. Unfortunately there was no venous return possible and his D had become edematous, swollen, and painful. He hoped it might subside, but then it started turning blue. By the time we saw it, it was extremely swollen and turning black. If he thought he was saving himself embarrassment by waiting, he thought again when we called the fire brigade to bring their large cutting instruments to free his strangulated member. Edit. The urologist said he would keep his peace but may suffer functional problems in the future. Doctor friend told me of a man with a flower stalk stuck up his D. He was trying to give his GF a birthday surprise. Unfortunately, flower stalks have little angled hairs on them which make them easy to push in but impossible to take out. Work in a burn center. For 3 months in a row we had 3 different people come in because they tried to commit suicide by setting themselves on fire with gasoline. I cannot imagine what brings someone to that point to think that's a good way to go out. Nurse here. Had a patient come in due to pain in her chest 4 months after having a mastectomy. When we changed her dressings, the site was so infected that I could see her lung inflating when she took a breath. She died a week later. Still don't know why she didn't come in earlier. Young doctor, but not my case. From my friend in city though. Guy called 112 and described his problem as a squirrel in the abdomen. After 5 minutes called back and said don't worry, I took care of the problem. Paramedics went anyway. NSFW. He cut out his bowels and spleen with scissors. After arrival to the hospital was given morphine and lived for 3 hours. Please, don't do drugs irresponsibly. Edit. NSFW equals more than NSFL. Edit 2. Drug found. It was called Mokaz, Eng, hard rock, mainly synthetic cannabinoids with a little bit of everything. My mother is an emergency nurse, and a while back a 90-year-old woman came into the department complaining of pain in her leg below the knee. After an examination, my mother suggested an x-ray. X-ray comes back and it turns out the leg had been broken several months prior, snapped clean across both the tibia and fibula, and she had somehow ignored what must have been excruciating pain and continued about her life. And then the bones had healed but not straight. The top of the bones were to the left and about 2 inches below where they were supposed to be, and they had fused to the lower parts at the side like that. In the end, there is nothing that could realistically be done, as to sort the leg out would require a breaking it. I'm not a doc but a medical technician. Still in college, but you see summit nevertheless. There was a guy who had a car accident damaging his cervical spine. Our occipital surgeon did an amazing job, so after a long process of recovery the man was able to walk using only a cane. Another problem he had was some neurologic muscle illness. Not sure if myasthenia gravis or something else, which made it hard for him to do any fine motor movements. Although he had all these health issues, the guy insisted that he is independent, so he did all of his daily activities on his own. The problem occurred when he went to his beach house on a vacation and went to take a bath. He lied into the tub and turned the water on. Then he turned on the hot water and realized that the faucet iced the same as he had back at home, and because of his motor skills being bad he didn't manage to turn the hot water off. Result? 2-3 degree burns on the left side of his body, from head to toe as he was laying on his side. He almost cooked himself to death. Not my story, but a co-resident's. A farmer from a rural area was using a table saw on a hillside. In the midst of cutting wood to build a shed, he slipped on the hillside and lopped off his D. How plausible this is, whether he was lying we will never know. Rather than seek medical attention, he takes a castration ring used to stop bleeding from castrated goats he kept on the property and shoved it down around the stump. If that isn't bad enough, he also began to have horrific swelling and decided to use a rabbit water bottle feeder, the kind you see in pet stores, to prop open his urethra so he could pee. He stayed like that for 3 days until he started to have fevers, redness, swelling, etc. due to infection, and he got to the ER. The triage nurse called the urology team. We have pictures. Basically what ended up happening was his urethra was translocated to his perineum so he could still urinate, and his infected necrotic D was excised alone with a portion of his scrotum due to the severe cellulitis in the area. He ended up making a full recovery after skin grafting to the area. This thread taught me what a million anti-drug commercials in high school couldn't. There was a patient in the hospital where I work, and one of his legs had gotten so infected it split open and maggots were living inside of the open wound, and he called them his pets. My doctor was very confused how 9-year-old me managed to completely rip my big toe's nail out at 3 AM. I tripped running down the hallway on the way back from the toilet, cause you know monsters, and slid along my carpeted hallway. The friction between my toe and the carpet ripped it out. Not a doctor, post-surgical nurse. Had a guy with necrotizing fasciitis, flesh-eating bacteria, on his scrotum. Had a wound vac that kept leaking. I had to change it. Was not pretty. By the end of it we were both traumatized. I'll never forget the agony that poor guy had to go through. But, on a good note, he healed up eventually. 70-year-old guy came into the VA clinic for a bad cough and admitted due to temp of 104F. He was mine and I found lumps on his neck on exam. He had tuberculosis, scrofula. So, why does he have TB in the US? We do HIV test and he's plus, but with some prostitutes. He also developed some other complications and was finally discharged after 4 weeks. Poor guy got a cough from Zix. Lady with very poorly controlled diabetes and morbidly obese came in via ED with a gaping hole on her thigh, like so deep you could put your whole fist through it. It was oozing ridiculous amount of blood, so much so she had to be transfused. Her blood levels were rock bottom. It transpires she'd accidentally cut herself when trying to wriggle into jeans. Meantime, the wound just kept getting bigger and bigger, and she attempted to just sort it by packing the wound with socks. Single worst thing I've seen. My neighbor was an ex-emergency room nurse. Whenever we would ask her about strange cases, most answers were you don't want to know. The only story I have is really strange. One day, a morbidly obese woman rolls into the emergency room. Her legs couldn't support her weight anymore, and complains about mild stomach pain. After letting several people with mild ailments get treated before her, she sits up and rolls to the staff-only water cooler behind the counter. My neighbor tells her about how the cooler is only for staff, and she starts to go away. Midway, she stops and from under her skirt a baby falls on the floor. Apparently this woman was pregnant and didn't notice because of her weight. How the heck didn't she feel giving the excruciating pain of giving birth? WTF. The baby lived. And apparently she just had intercourse without protection and was stupid enough to believe she wouldn't get pregnant. I'm not really sure if she kept it or not, but I'd like to think so. I've had a patient with myiasis on the nose, who had flies coming out of his nose. Had a lady in the ER who had a vibrator in her rectum. She was extremely embarrassed but came to the department for removal. We took an x-ray. Sush had pooped it out and didn't even feel it come out. Osa got a bill and mortified. Not a doctor or even in the medical field. I saved this comment from another post. OP was an OR nurse and witnessed the most horrific, gruesome patient experience I have ever read. I felt nauseous just reading it. That being said, I felt the need to share it with everyone. Link. Just last week I had a guy over 400 pounds, BMI 60. He was a hoarder and kept getting cellulitis in his legs because his house was so cluttered he kept hitting his legs into things and getting cuts and infections. When he came in we had to remove his socks with scissors because he hadn't taken them off in over 3 months. His socks had embedded into his skin and somehow become one. I didn't learn in medical school how that happens. Not me, but a nurse friend. Guy comes in complaining of pain sitting down, pain in his rectal area. She goes to take a look and this man's anus is so infected it was almost gangrenous. The infection wasn't just around the anus. It had traveled inches deep into his body, literally using pus. One nurse had to excuse herself and almost passed out due to the smell. I was told, no idea what caused it or whatever happened to the poor guy. This doesn't quite meet the how did this happen part but still hits the what the duck part. My cousin is a doctor and she once had this 300+ lb lady who came in with a horribly smelly skin rash. After some initial inspection they found a Twinkie under one of her skin folds. It turns out she and her boyfriend play a game where she would hide various snacks in her body and her boyfriend would have to find it. The game in question was 2 months prior to her hospital visit. I guess she won the game. Mother-in-law was a doctor. We asked her this one day. 99% of the time she wouldn't tell you anything. She was a good doctory, privilege, etc. One day we got her drunk. That is, she had like 2 sips of wine and lost her it. Loose lips sink ships. But all she'd tell us was one day the son of a huge celebrity. She wouldn't give any hints at all as to who came in. And he was something like 8 years old. And he had a crazy hard weird spot on his leg. There was a scar over top. Kid couldn't or wouldn't give any explanation except it hurt. And the celebrity wanted it taken care of right now. She was a great doctor and accompanied them to the ER. Cause that's where you go for insanity. Not your family doc. It was a dinky car. Under the skin. Wound or whatever healed over. My wife works ER. A man came in that had fallen off his roof holding a chainsaw and landed on it. He lived. Patient, a farmer, needed complete bed rest. He convinced me that he would rest at home so was discharged. Admitted 2 days later with a crushed foot. His explanation, a beast stood on it. He meant a cow. Not a doctor but a paramedic told me this one. Got a call to a house where a teenage boy had suffered a D injury. Remember those glass stirring rods from science class? Kid took one home and put it down the eye of his D. It broke. Shudder. The human capacity to deny the undeniable is amazing. As a radiologist I've seen an 80-pound ovarian tumor, a hand-sized facial malignancy neglected until it eroded an underlying artery, numerous neglected breast cancers, eroding through the skin. People will refuse to see what they really don't want to see. Doctors were surprised when little third grader me was brought in with a lacerated spleen and lungs gradually filling with fluid. I tripped and fell off of an 8-foot bridge into a creek on my dad's property, and a rather large rock caught my fall, hitting my ribcage just right. My dad thought I was just being a pussy and told me to sleep it off, but 8 hours later my mom found out, They were divorced and rushed me to the hospital. Thankfully, spleens are very good at regenerating and I made a full recovery with some physical therapy. Saw a guy who had a pretty blunt machete lodged perfectly across the middle of his skull. But the angle was unusual and it was like perfectly along, so that caught my attention. Turned out the guy had, unsuccessfully, tried to murder his wife with the machete and later regretted it, so he hit himself in the head with it. He held it with his hand, sharp side front, and gave himself a whack perfectly in the middle of his skull. Thankfully the machete barely made it into the skull, and since it was along the middle it didn't touch any brain tissue. My mill told me the story of a lady that had come in complaining of abdominal pain and smelling absolutely foul. Turns out she had tried using a potato as a sexual toy and was able to get it full inserted inside her V but couldn't pull it out. So she decided to leave it in there with the hopes that it would work its way out. It sprouted inside of her and then eventually started to rot. They had to surgically remove it. She also told me the story of a guy that had a surgery for something and while in recovery had asked her for some tampons. She was confused but gave him some anyway. Turns out he had so much rough gay sex that his sphincter no longer worked correctly and he used the tampons to keep his ass from leaking. Nurse here. A girl came into the ER with a retained bottle cap over her cervix. That had been there 2 years. 2 years. This story was told to me by a doctor. A 38-year-old man came in complaining of terrible headaches. The doctor ordered an MRI and found a steak knife blade embedded in the guy's head. The entryway was through his eye. Apparently the guy had been in a bar fight 20 years before and had been stabbed, but didn't realize he'd had a knife blade in his head for 20 years. Got so many. Not a doctor but a nurse practitioner in the ER. Toy car in a condom in the butt. Giant pill bottle in the butt. The best is probably the guy who was being a good Samaritan and picking up the garbage bag in his neighbor's driveway and, sure enough, needle slipped out and got lodged in his left AC. Our surgeon called him on his bullet, which was hilarious. Heroin user. Bullet. A very tame example, but here's one mum. An ex-nurse told me, one day a patient came in who had basically no social interaction whatsoever. So he looked like a complete mess, with hair nearly down to his hips. As the nurses cleaned him up they noticed his hair was quite thick around his head, and they couldn't cut through it. Turned out the guy had been wearing a beanie for the last 10 years and his hair had just grown through it and over it. Might be buried because I turned up like 6 hours late, but here goes. Friend of mine saw a lady in dermatology clinic with a basal cell carcinoma that she'd left alone for so long it had eroded into her orbit, the bit of the skull which houses the eye. A slow growing skin cancer that could have been cut out in a single visit to the doctor now meant she had to lose an eye through a massive skull surgery. And all because she didn't want to bother anyone. Not a doctor, but my grandpa, RIP grandpa, was a heart surgeon and also an ER doc for a while. He told me this story about his time in the ER. Hungarian accent. So I was there in the office when a man came in with a look of absolute pain. I asked what's wrong and he said it would be better discussed in private. It turned out that he caught his D on his zipper. All I could do was give a good yank. Cue me cringing at the thought of that and grandpa with a big ass grin on his face. I love you grandpa. Obligatory, not a doctor but I am a nurse. And this was literally a case of we have no idea what the duck is wrong with you. It was a long time ago and I was never this patient's nurse. I just heard about it through the grapevine at the nursing station. A healthy and relatively young, 40s or 50s, man was brought in by EMS because he was found unconscious in his home by a friend. He lived alone and so no one had any idea how long he was out for. He was revived and brought into the hospital and was admitted to my unit. Other than his creatine kinase, CK, levels being through the roof. For those not in the know, if you're stuck and don't move for a long time, the muscles at the pressure points will break down causing rhabdomyolysis. Every test kept coming back normal. The doctors put him through every test they could think of, tons of blood work, CT scans, MRIs, ultrasounds, etc. But everything kept coming back normal. The patient's vital signs and condition stabilized after a few days, too, and his CK levels steadily decreased. He ended up returning to normal and he was discharged without ever finding out exactly what had happened to him. My friend is a doctor and he once had a patient who accidentally shot his D off because his gun went off in his pants. Not me, but my best friend is a nurse. Said the worst thing she ever saw was a guy coming after a motorcycle wreck. He was still moving, breathing etc in the ambulance, but once he got to the ER, they had to cut his helmet off. Apparently the helmet was the only thing keeping dude alive. Once his helmet came off, his brains splattered everywhere and he was dead on the table. Old paramedic here. I had a 60s male found on his hands and knees quite dead. He was positioned to receive a dildo mounted to the door lifter on a garage door opener. The track was modified to run the length of a mattress powered by the 1-stroke 2 horsepower opener. He used the remote button to forward and reverse the lifter with a plate adapter for a large rubber dildo. He had taken a massive heart attack. Not a doctor, but a witness to something. My family went to Disney World a few years ago and we met up with some family friends. On the Space Mountain ride, the husband raised his hands. His wedding ring got caught on something above him, and it ripped his finger almost completely off. It was hanging by a piece of skin. Thankfully he got into the ER soon enough to save his finger, but he can't move it and doesn't have feeling in it. Doctor, multiple incredibly advanced cancers, mostly breast, head and neck, cervix, and anal. 1 or 2 vulva cancers that was particularly bad as well. Worst non-cancer case was during intern year. Morbidly obese man comes through ED. So large he had to have 2 bariatric beds pushed together. He wasn't to be my patient, but he had a lot of anxiety and embarrassment with female doctors. For some reason we just had a connection. I really felt like he just needed to talk. Talked about his situation, own life, all of it. He had this calm and peace about him despite his health. He passed away 2 days later. At first it was hard to comprehend how life would come to that. Yet in the end I understood. I'm sorry man, I wish things had been better. Training as an EMT, so not a doctor, but in the ER. Old guy shuffles in with his girlfriend, both mid-50s. He is holding a members only jacket in front of his crotch and waddling in. We take him through tridge to the back and get him on the exam table. His scrotum was the size of a large watermelon. It hung below his knees and was easily 18 inches in diameter. Serious hernia issue. Just a big oblong mass of flesh that had overwhelmed the rest of his nevers. I think every physician in the hospital came down to consult on it. I mean everyone. Cardiologists, NCTC. Everyone made an excuse to come take a look. This was clearly an issue he had been avoiding for years. The prescribed treatment, if I remember properly, was to Kevlar reinforce his belly and shove all his intestines back up and in. They were going to transport him to a nearby hospital for the treatment, but because it was across state lines he refused to go. So he slid off the table, pulled his jeans up around his crotch, grabbed his jacket and his girlfriend and shuffled off to the bus stop. It's an image you never forgot. Closest thing I can relate it to is when Hugh Jackman is trying to carry the fishbowl between his legs in The Prestige.